Hi, I'm Dr. Laura Hanson. I am the owner and founder of Original Development and Therapy Center located in Dunwoody, Georgia. This is the beginning of a video series where I am reaching out to parents, teachers, therapists, family members, and the community at large to tell you about a unique approach in working with children with neurobehavioral challenges. You might be a parent of a child that's been diagnosed autistic, Asperger, ADD, ADHD, OCD, ODD, PDD, developmental delay, the list goes on, even elemental OP. It's endless. You might be a parent who's adopted a child and notices that there are some developmental challenges. You might be a parent that notices that your child is not developing as expected. This facility is for you. Family is at the heart of our practice. This is a dynamic approach to work with families as a team. We work together with what has to go on in your life while you try to bring your child to resolution. At the heart of Original Development and Therapy Center is our assessment. We spend a great deal of time with you, accumulating the information that will give us the exact picture that we need to understand who your child is right now. We look at the pregnancy, we look at the birth, we look at the first few years of life up until the age of that child when they come into original development. That information provides us the direct input to understand how to help your child. That information is vital, and it needs to be a dynamic communication so that we truly understand the origin of health that your family is currently in. The next part of our practice is a movement program. I'm in my favorite room right now. In this room, there's a variety of movement pieces. This is a rock climbing wall directly behind me. Every child that comes in here, it's the first place that they go. Movement is the key to development. Every child moves before they ever learn to read, write, and do arithmetic. Your child is supposed to lift their head, roll around, crawl on their belly, crawl on their knees, begin to stand up with the assistance of furniture before they ever take their first step. There's a sequence, a progression of development, and each piece is vital. Each piece is a staircase in order to turn on that higher brain. The second part of our assessment looks at the chemistry, the physiology. What's going on in the gut? What's going on with good bacteria, bad bacteria? Where are deficiencies noted? We utilize functional labs in this practice. Let's explain that piece for just a minute because it's crucial. Many people are able to accumulate a traditional medical lab. However, are you aware that what's happening with those lab values is they are changed every year? They are based on how many people took the test and what the averages were. That is exactly how a within normal limits is delivered to that lab report. Now, most of us do not wish to be compared to only averages. In fact, I want to use the word optimal. Optimal is exactly what that body needs in order to thrive. And when you're a child, you need optimal physiology in order to fuel the neurogenesis or the making of nerves. The first 3 years of life are vital to your child. Your brain is going to grow more in those 3 years than any other part of your lifetime. When that neurogenesis is completed at around age 3, there is a process called pruning. And whatever circuits are not pulled together to be the most efficient literally get pruned away. So it is very important that we get this information out to our community. It does matter what you feed your child. And we want to provide you with that information so that you can make the best educated decisions on how you're going to feed your children and your family. The emotional piece is critical as well. Now, I'm not a counselor, and we do have resources for that. However, we are a brain-based program, reconnecting brain, body, and health. In one of the later videos, you're going to hear about one of our diagnostic tools called the Neuro Infinity. We literally do an EEG or brainwave assessment on how your child is responding to traditional stressors, an environment, a cognitive challenge, an auditory challenge, and just their own biophysiology. How well do they breathe? The brain needs 3 things: glucose, oxygen, and stimulation. That is the core of how our management plans are put together in our practice, and each child is handled individually. If you are getting results with the current program that you are with, I encourage you to stay there and keep working. If you're not getting results, I ask you parents to take that step. Come over to Original Development and Therapy Center and allow us to share our services with you. You are entitled to a complimentary consultation, and you are welcome to come by the center and see us in action. Please visit us on the web, originaldevelopment.org, and my direct number is 770-853-0945. I look forward to serving you and your family.